to take you through a Pilates series, which is great for those first few weeks after having a cesarean section. You can also use this video in this sequence after any abdominal surgery. Our goals here are not to necessarily exercise us, but to straighten up our postures, connect with the deep tummy muscles which we'll need every day to do our normal activities and to move, to help create that length and that space back in our body, to ease pain, help your breathing and relax your body and mind. So you're going to start lying on your side. You're going to need a big towel to support your head first of all, or a few cushions. And when you're coming onto your side, just take it really nice and slow, easing down onto your side, and take the big towel or cushion underneath your head. And you can stay curled up to protect your tummy to begin with. Bring your legs right on top of one another and then your hands together. You're going to reach with your top hand all the way forwards and then trace a straight line across the ceiling looking at your hand. This is going to open up your chest, allow that stretch to happen, your head rolling across your towel or pillow. Breathe in with your arm out behind you. Breathe out and bring it all the way back. Two hands are going to close. And again, reach your top hand, trace a line across the ceiling. Glance down and make sure that your knees stay on top of one another. It's tempting for that top knee to slide back, but don't let that happen. Your head should roll across your towel, your arm comes down to the floor. Breathe in when you get there. Breathe out and change. So when we have a sore tummy, it's very natural to roll our shoulders forwards. So this is just going to help us straighten up that upper back again. Come into this third arm opening. Breathing in when you get there. Breathing out to change. Okay, now you're going to take a second cushion or ball between your knees. A soft Pilates ball, such as this one, is a really great tool. So if you look for a soft Pilates ball online, they're really easy to get hold of and you'll use it a lot in your rehabilitation. So now we're going to put that between our knees. We're going to start with our first activations. So as we squeeze the ball, we're going to see if we can connect with our deep tummy and our pelvic floor. So first we need to make sure we're relaxed. Place your hand gently on your tummy and breathe in. As you breathe in, your tummy should gently move out into your hand. And as you breathe out, your tummy will naturally come back in. As your diaphragm retracts and pushes all your air out. Breathe into your hand. And breathe out. Next out breath, we're going to squeeze the ball. So breathe into your hand. Breathe out, squeeze the ball between your knees. Keep breathing out for a count of 6, 3, 2, 1. Breathe in, release the squeeze. Tummy fills up, diaphragm comes down. And again, breathe out, count to 6, squeeze the ball, breathe out. Keep breathing out, make that go long. And breathe in. Release the squeeze, let the tummy fill up. 2 more practicing this. Breathing out, squeezing the ball. Lengthen your out breath. You'll probably naturally feel your tummy draw in against your hands, not bracing or tensing too hard. Breathe in. But that's your deep tummy muscle connecting. Breathe out. The ones which attach with your inner thigh to the front of your pelvis and pelvic floor. Keep breathing out. And release. Now we're going to start to straighten out our body, which is going to give that low wound a bit of a stretch. So just take it to where it feels comfortable, maybe about halfway, not fully straight so far. When you start to lengthen out your whole spine, see if you can take your hand underneath your waist so that you know your spine is straight and not sunk down into the mat. So keeping your waist up and lifted. We can do the same thing here. We're going to breathe into our hand. As we breathe out, we're going to squeeze the ball and count 6, 3, 2, 1. Breathe in. And breathe out. Ball squeeze. Really squeeze that ball. There should be no pain or discomfort. Just a sense of things coming on and working. Breathe in. 2 more. Breathe in, last one. Breathe out. Lengthen your breath for 6. Squeeze the ball. 5, 4, 3, 2, 1, and release. Okay, now we're going to try and go fully straight. So use your hand on the floor and slowly take your legs down straight. Just take it to where it feels comfortable. You might not get fully straight the first few times you do this. As you lengthen out that skin, it can tug a little bit on your scalp. Don't push it in that first 6 to 8 weeks. Just take it slow until where you can. The most important bit, wherever your legs might be, whether they're bent or straight, is to keep your waist lifted and your spine long. And let's go again. We're going to breathe into our hand. 4 more here. Breathe out, squeeze the ball. Feel the tummy pull in. Really squeeze the ball between your knees. Lengthen your breath out. Breathe in. And again, we're going to breathe out, ball squeeze. And breathe in. And again, breathe out. You'll probably notice that you're getting better at this as you practice. What we call motor control or muscle memory. Your body remembers how to define these muscles and move them and sync them with every breath. Breathe in. And one more time. And release. Now we're going to take the ball away and place it just off to one side. You're going to use that again in a moment. And keeping your knees bent, see if you can maintain that waist lift and start to give me a little clam movement here. That's a roll from your hip. What we're going to try and do is find the muscles at the back of our body, the ones countering the effort from the front. We're probably spending a little bit more time relaxing and sitting at the moment, which is absolutely fine and what your body needs to do. But you might notice that other muscles are starting to switch off, not just the ones at the front which you're trying to protect. So we're going to make sure that our bottom and our lower back stays active and strong during this recovery period. So all your muscles are still there when you need them. So we're going to squeeze our heels together and I'm trying to keep my whole body dead still. No movement or sway through the pelvis, just moving from the hip socket. And we're going to do one more like that before we lift both feet up off the floor. So we're going to roll forwards and raise both feet. If this is too much effort to start, then stay with level 1, otherwise follow me with level 2. And again, we really squeeze our heels together. We try and maintain that lift in our waist. And use each out breath to pinch those heels and roll open the top knee. You should feel both sides of your bottom working with this one. 2 and 1. And lower your feet down. So now we're going to repeat that, but for a different muscle group in our bottom. So use your hands to help you curl back to our original start position, where there should be 90 degrees at our hips, 90 degrees at your knees. From here, roll open your top knee, pressing your heels together. Breathe in and release. Breathe out, roll open. Breathe in, release. It's important here that your body is straight as though you are lying against a wall. You can even lie against the wall if you need that to help you to check. Or just feel for your mat behind you and check that you're right on the edge of the mat with both your bottom and your shoulders. It's tempting to tuck our bottom underneath us and do it from here. And you might notice then your thigh doing more of this work and not your bottom. So keep your bottom out and your spine long. And then you start to feel that lovely bottom burn like it's working. And the rest of you should feel totally okay with this. No pain. Alright, now if we can, we're going to do a second set just like that, or with our feet lifted 1 or 2 inches off the floor. If that feels like it's working your tummy too much for now, stay with the first level. Otherwise we're going to go from here and challenge both sides of our bottom. Breathe out to open, breathe in and close. Breathe out and open, breathe in and close. Three, 2, and 1. And lower your legs all the way down. Now we're going to do a quarter roll to lie on our back. So take it really nice and easy. Use your arms to help you roll. Use your legs to help you roll and change position. So I want you to keep your big cushion here, which is going to keep you curled up a little bit and protect your tummy wound. And keep your legs bent to begin with. We're going to slowly lengthen your body out. Bring your hands round onto your rib cage, so just below your bra strap. And I want you to just give yourself a little squish here, just a gentle one. And then as you breathe in, try and push your hands away with your ribs. And then breathe out, try and squish the air. Just gently squish the air out away from you again. Breathe in, use your breath to push your hands sideways. And breathe out, give yourself a gentle squish. Keep practicing that, trying to move your ribs east to west so you're not inflating and deflating your tongue, but you're using your diaphragm, the roof of your abdomen, and that's going to help your tummy healing and your pelvic floor recovery. One more breath. Okay, so now we're going to see if we can take that cushion away. If you can't, just make the cushion a little bit thinner. Just carefully slide it away from your hands and ease your head down to the mat. And that length is going to help to reset your posture. So your neck should be long, like I'm pulling your head up the mat and making your neck stretch as much as possible. Then we're going to open our collarbones and try and lay our shoulder blades flat on the floor when our palms are up. We're going to do some pelvic tilts here. So that means pressing our lower back into the floor, tucking our tailbone underneath us, and then rolling away, arching our lower back away from the floor, pushing our tail down and into the mat. You're trying to keep everything from your ribs up, dead still, and the movement is all coming from your knicker line. So everything underneath the top of your trousers is doing that movement. To arch and tip your pelvis forwards, to flatten, curve, press your pelvis back. And again, tip forwards and press back. Just a couple more here. Just gently feeling that movement happen through your tummy. Again, should be no pain, no pull, no tug. And now we're going to take the ball back in between our knees. We're going to take our legs down straight, nice and slowly. See where you can go. This is the biggest stretch yet. Just walking your legs away from you until you can get them as close to flat on the mat as you can. And there may well be a tug here, so we're going to bring our hands back up to our ribs and we're going to breathe again. So as you breathe in, allow your ribs to press your hands away. As you expand your rib cage to the sides, breathe out and squish your ribs in. Breathe in, press into your hands, expand them to the sides. Breathe out, press your ribs closed. And again, breathe in. And breathe out. So remember that breath and that feeling. Slide your hands down onto your knicker line. And what we're going to do now with our next out breath is squeeze the ball at our knees and see if anything's happening in the lower tummy. So we're going to breathe into our ribs. Breathe out, ball squeeze. Squeeze the ball between our knees and feel the lower tummy, if you can, engage. Those muscles draw together. Breathe in, expand into your ribs. Breathe out, squeeze the ball. Notice as if anything is happening in your low tummy. Breathe in. And again, breathe out. And the corset should be as though you're putting on the feeling should be as though you're putting on a corset. Those muscles just gently tightening through your middle, not bulging outwards, not bracing hard. Breathe in. And out. It's like you're zipping up a pair of jeans. You're just gently pulling in your skin, so away from the zipper. Feeling that corset of muscle come on and knit back together. Breathe in. One more time, breathe out. Breathe in. Now that might be enough for you for now, but if you can, we're going to try and add on an out breath and an arm overhead. So start with your hands pointing straight up to the ceiling. Use your in breath. Out breath, ball squeeze, tummy corset comes on, and at the same time our arms are going to go over our head. Big, long postural stretch. Breathe in, return your arms, release the squeeze. Breathe out again, squeeze the ball. Zip up your jeans, take your arms over your head. Breathe in, return, release. And I want you to pay particular attention to the way your body feels on the floor. Each point of pressure. Squeeze the ball, breathe out, arms up. Make sure your body doesn't leave the mat. Breathe in, return. It's going to be particularly tempting for your ribs to lift up. Squeeze the ball, breathe out, arms up. Breathe in, release. And so I want you to keep your ribs glued into the mat. Your pelvis in this neutral position. Your neck relaxed. And your shoulder blades flush with the floor. 3 more like this. Just take your arms just as far as you can. You might start to feel how your arms feel heavy here, like 2 weights you're lowering overhead. And it can just make the tummy pull a little. We don't want there to be any pain. Just a little tension coming on. Last one. And release. So now we're going to roll onto our other side and we're going to do those movements on the second side. So gently walk your legs up. You can either just roll onto your other side or come with me, help yourself back up into sitting. Bring your folded cushion with you. Change your leg position to the opposite side and ease yourself down here into side lying. Okay, so we started with our legs closed and our arms out in front of us. Just get in a comfy position and keep your legs glued together. Take your top hand forwards, reach up to the sky, and then allow your arm to open, your chest to open, roll backwards. Breathe in. Breathe out. Return, reach through your fingertips, close your hands. And again, reach. Enjoy this stretch. Make sure you've got enough pillow underneath your head so your neck can roll and you're not straining through your neck. Should be a nice flow, a good postural release, a chance for you to open up and breathe. Last one. Reach, open. Breathing in here, breathing out, return. And now the ball's going to come between our knees. We're going to take our hand onto our tummy and take a breath into your hand. Make sure it's relaxing as much as can be. And then when you're ready, on your out breath, we're just going to squeeze the ball. Count to 6. As you breathe out, count in your head. 6, squeeze the ball. 5, keep squeezing. 4, 3, 2, 1. Breathe in, tummy fills, relaxes away from you into your hand. Breathe out, count for 6. And breathe in. Fill your tummy up. And breathe out, squeeze the ball. Push all the air up and out. Feel your tummy draw in. One more time, breathe in. And breathe out, squeeze the ball. And release. Okay, use your hands to help you start to straighten out your body. Now in this new position, you want to try and get a straight spine, and you'll know that when you're there because you'll be able to slide your hand underneath your waist. Hand back onto your tummy. You're going to breathe in, Breathe out, squeeze the ball and try and lengthen your breath for a count of 6. So you're slowly breathing out, using your diaphragm and all of the space. Breathe in. And breathe out. Squeeze, squeeze, squeeze. And again, breathe in. And breathe out. One more time. And breathe out. Well done. Now we're going to take that ball away and start from this position with our heels together, coming into our first clam. Check your spine is straight, your waist is lifted, and roll your top knee open, squeezing your heels together really, really strongly, so that you work through the back of your pelvis, close down the back of the sacrum, giving you that stability even when you're sitting, even when we're not active and moving around so much, keeping our pelvis closed. Push your heels together, hold your form. Use every out breath to open, in breath to close. One more. And release. Okay, short rest here before we go again. You can do the same level or follow me into level 2. We lift both our feet up off of the mat. We squeeze our heels together and we roll the top knee open once more. So you're just feeling your deep seat work. Maybe a little shake to hold your stability here. Again, there shouldn't be any pain or pulling around your tummy. All of the effort we want is low, to be matching or similar to the effort of just everyday tasks, so that you're doing them with the right muscle sequencing, with not too much compensation or muscle guarding from your bigger muscle systems. Two more. And release down. Hand down on the floor now. You're going to slide your legs up and in. Keep your waist lifted if you can and start to clam from here again with your out breath. Keep your shoulders relaxed. Your neck should be fully supported. Again, remember if you can to squeeze your heels together and move with your out breath. Every time you breathe out, your diaphragm comes up and there's a reciprocal lift of your pelvic floor too, even though you can't feel it. So that works really well with the muscles on the inside of our pelvic floor, as well as these muscles on the outside and our bottom working at the same time. Okay, now second set, either the same thing again, or we're going to lift both feet up off of the floor. Okay, from here we're going to roll open and close, open and close, open and close. Push your heels together, roll through your hip. 4 to go. And 1, and relax it down here. Well done. Okay, so now we're going to take it back onto our backs, but before you do that, I want you to open out your towel or cushion so it's just one thin layer underneath your head. And we're going to roll carefully onto our backs, keeping our legs together, and we're going to have and do some pelvic floor exercises here. So your pelvic floor is the floor of your pelvis. So when we've been pregnant, that floor takes a good stretch from the carrying the weight of our baby, whether we give birth vaginally or not. It's the carrying and the weight of the pregnancy which can be just as much a shock and strain to the pelvic floor as birthing vaginally. So after cesarean section, after any abdominal surgery, where we destabilise the walls the floor can be knocked off as well. So we're going to try and make sure we're switching on the floor to help recover the walls and to keep the whole system working together. So find your best posture here. We've got a thin cushion so our neck is long. Our shoulder blades should be on the floor, rib cage on the floor and pelvis in neutral. So that means not too squished into the mat and not too arched away. When you take your hands onto the bottom part of your pelvis, your hands should be flat, not fingers to the sky and not fingers pointing down, just flat. And then you can keep your hand there. And what I want you to think about is doors running underneath you like an elevator from one hip bone to the other. And as you breathe out, try and slide those doors shut, as though you're shutting your vaginal opening, bringing and sliding the two sides of your pelvic floor together, then hold it here. Now imagine that elevator moving up and in through your body, keeping the door shut. Pull that contraction up like you're moving your elevator up and in just to your pelvis. Pause, keep your door shut, and then pull that elevator up a little bit more towards your belly button. Hold it here if you can, breathe in, and then lower your elevator down all the way, and then open the doors. Feel it recoil back towards your hip bones. Breathe, and let's go again. Breath in, breathe out, shut the elevator doors on your pelvic floor, and then pull the elevator up. First floor, pause, top floor, hold, breathe, and then release it down through the layers, rest completely, and let the doors open. One more time here. We're going to breathe out, we're going to slide those doors shut, shutting our pelvic outlet, imagining drawing hip bone to hip bone, and then pulling up through the tummy, lifting that elevator as we go. Pausing at the top, breathing in to hold. And then breathing out, moving back down through the layers and slowly opening the elevator doors at the bottom and release. Now you can practice that as many times as you need to find and feel all the layers, the lift and the release. Try it in a few positions as well. Now our last exercise is going to be in standing, so take your time to get there. I recommend rolling onto your side, using your hands to help push you up, so it's not a big tummy action. And then from your hands and knees, putting a curve in your whole body, rounding your body towards the ceiling, tucking your toes, and then shifting your weight back towards your feet, and then lifting your knees up. And then nice and slowly straightening your legs, and restacking your vertebra one at a time, opening up your back, opening up your tummy, and regaining that straightness in your body. Shoulders roll back, head lengthens up. And now you're going to come and stand against a nearby wall. And you want your feet about 2 feet away from the wall, and your body supported against the wall. Make sure if you're wearing socks that you're on something that's not going to slip away from you, or take your socks off so you're on firm grounding. Okay, now what we're going to try and do is get our shoulders open, so our collarbones are open, our shoulder blades flat against the wall, and our neck long. Keeping the upper body still, I want you to try some pelvic tilts, allowing your belly to spill forwards, and then pressing your lower back into the wall, tailbone lifting up, belly pulling in, bottom gently lifting up away from the wall. And then release, bottom presses into the wall, belly spills forwards, feel a big, big, big gap come between you and the wall. And then reverse, body into the wall, back presses in, bottom starts to lift off, and then release, back arching away. One more time. And release. So now what I want you to do is bring your body into a neutral position. So your back should be in line with the wall, flush with the wall, not pressing into it and not a big cavernous arch behind you. So your back should just be gently touching the wall. On your out breath, I want you to maintain that position and take your arms over your head, trying to make that out breath last the full 6 seconds. Breathe in and lower your arms all the way back down. Can feel like a stretch. Remember, we're trying to straighten out your posture. We're trying to challenge that upright position back in your frame and your body. Take it where you can. You might not get your arms all the way up to begin with, but see how you go. So your goal is not to let your back lift up and to maintain this position. As you start to improve your control and your form and your posture, see if you can add in that pelvic floor elevator. Closing the doors at the bottom, lifting your elevator all the way up as you breathe out and take your arms overhead. Breathing in, releasing down, and relaxing your pelvic floor. And again, breathing out, closing the doors, lifting all the way up, breathing in to lower, and release. Just going to do 2 more like this together before those legs start to shake and feel it. And if I'm going too quick for you, just go at your own pace. Learn how to do the exercises and then make them fit you and what your body needs. And release all the way down. Press your legs to straight and pause here. Come into a little side bend to finish, stretching all the way through one side arm coming up. Natural little stretch through your tummy, maybe a little tug but no pain. And then slide back down the wall to the other side, lifting up your opposite arm. Feel a little stretch and length through your waist. And then come back up to stand. You can do this little series as many days as you like, giving your body time to rest and recover, but also regaining that posture and your strength to see you through this postnatal period.